On December 31st, 2019, a novel coronavirus was first detected. This was the start of the COVID-19 pandemic. This event changed the lives of everyone, a change intensely felt by our healthcare workers and professionals. Join me, Ryan Funk, as we sit down with Manitoba-based frontline workers, immunization specialists, doctors, and nurses with diverse backgrounds to share their stories, experiences, and contributions during the pandemic in Canada. Today we have Dr. Agostinho with us for Together We Can. Thank you for joining us.
Absolutely. Thank you for having me.
What an interesting experience. Interesting, let's just put in quotation marks there. I guess for yourself, when we were first starting to get that news, what was the reaction you were having at that time?
A little bit of apprehension, not knowing what was coming, I guess, was the biggest one. I probably didn't have as much fear as, say, my mom did. My mom was very worried about me going to work and what that would lead to. We really just had to play it by ear after that.
It was just such an interesting moment because where I was at the time, I was living in Winkler. So the reaction I was hearing from people there was always, it's not going to be a big deal. It's just going to be a flu. Everyone's overreacting. And now millions of deaths worldwide because of this whole thing. And it's just like, wow, this whole situation came in and it feels weird almost like we've had this like massive world-changing event that has gone through and then, we're out on the other side. Some of us luckier than others.
And I think I was a little bit guilty of downplaying it at first as well before it came to Manitoba, just hearing about it in other parts of the world. And it's interesting what social media has influence on, right? Because everybody touted it as just a really bad flu. And so at that point, I hadn't really looked into much about it until it came to Canada and we saw it getting closer and closer to Manitoba. And then I started looking at some of the case studies that they had put out. And I said, oh, well, no, this isn't just a flu. Like, this could be very, very bad.
You went from public to private practice during that time. I guess, what was the experiences being in both those different areas of the healthcare system? And let's go with before the vaccine and then post-vaccine, kind of like what was the reactions and just how the work life was like during that time?
Actually, I ended up switching between clinics around the time that the vaccine came out. So I didn't get to see post-vaccine in one clinic, and I didn't get to see pre-vaccine in the other. But in the government-run WRHA clinic that I originally was working at, it was pre-vaccine. And so there was still a lot of fear and uncertainty about seeing patients and possibly catching COVID, bringing it home to your family, that sort of thing. A lot of fear and apprehension on the staff side, and also on the patient side of having to come into a healthcare facility where other people potentially could be ill and infect them as well. And then transitioning over to a private clinic was when the vaccine started rolling out for everyone. And you saw some of that fear and apprehension lifted because people knew that if they did catch COVID, it wouldn't be as severe and their chances of passing it on to someone else, one of their loved ones, wouldn't be as bad as well. And so you saw it on both sides. The staff were a little bit more relieved and the patients weren't as apprehensive either.
Yeah, it was definitely almost like a sigh of relief when it finally came out. Because I know for me and a lot of my friends, it was just like, once we had that and some time when settled and things started opening up again where we could actually see people, it was a good moment to finally like almost feel one normal quotation marks in that moment. But once again, it was still going on. Our healthcare system was, being pushed to the brink at moments.
Yeah, and I think that's something that I know was frequently brought up in the news, but I don't know that people realized the depth of it, right? Yeah. So we had it was just a case of bad timing. We had just shut down some facilities. We were in the process of restructuring our healthcare system, and then the pandemic hit. And so things weren't already rolling the smoothest to begin with, and now we've thrown an extra hurdle at it with minimal staff, not enough resources. It was just a bad situation all around at the very beginning.
Yeah, and of course, people getting burned out throughout the whole thing. Like, it was a long time. Like, I almost forget how long it was. Like, what, 3 years total? 2-3 years total? We went through everything.
Yeah, I think
time is a little woo.
If I'm not mistaken, it was March 14th of 2020. So last year would have been 3 years.
3 years. Wow. Time just feels weird. It feels both long and short
at the same time.
At the same time, which is just a bizarre phenomenon.
Yeah, I like many other people, will think back to, when did that movie come out, for example? Yeah. And then you think it was like 5 years ago, and no, really, it was last year, but it felt like it was 5 years ago. So, yeah, a little bit of readjustment.
So another big thing that our healthcare workers went through was the challenges with PPE. For the everyday person going out, there was that initial panic buy with everything, where people are trying to buy as many masks as they could, what was ever on the shelves, buying hand sanitizer, buying toilet paper, and then the shelves were just empty. What was the situation like within the healthcare system, at least where you were working at?
I think it was a bit different in that the government is the one who kind of regulated who got what, and they tried to share it as fairly as they could so that everybody had a supply. It was a little strange trying to create ways to ration the supplies that we did have. So, for example, previously to the pandemic, we would use the mask, and we knew that if it got saturated with saliva or with our moist breath, things like that, after 20, 30 minutes, we should throw it out.
Yeah.
And now we've switched to pandemic times where you got a mask, and that was your mask for the day, and you did whatever you had to do to make that mask work. So it was...
you got to stretch it. You got to make it work.
Yep. You got to work with what you have.
Yeah. And I mean, for lots of us, wearing a mask was annoying. I have a beard, so it would scrunch up, it'd be itchy and things. But for our healthcare workers, wearing a mask, wearing a shield, wearing that gown and everything, the amount, the physical toll that probably takes on a full shift. And it's not like you can just clock off if there's a bunch of people showing up at one time.
It gets very hot under there. A lot of us had to deal with new acne. Felt like we were in high school all over again. Just couldn't get rid of it for the life of us.
What was it like working with patients, going to that virtual setting? Obviously, there's a lot of challenges involved with, how do you figure out what's going on with them? If you can't be oh, this part hurts sort of thing, and maybe they can't describe things as easily in a virtual setting.
It was interesting. I think there was a lot of personal growth as individual doctors, but there was also a lot of new things that came out in the healthcare community in general. So there was a lot of scales and tools put together to determine certain things. For example, if someone was speaking to us and they were breathless and they couldn't get through a phrase that's 11 words long, but they could only get to the fifth word before they had to take a breath, then that meant they were this much... this level of breathlessness. So there was things like that came out that were very unique and which we still use today.
Yeah, the adaptability of, technology and things. The same thing with Zoom and all those other things where for a lot of people, it was the first time being whoa, virtual calls, meetings, for our schools and everything, it was a completely different situation to kind of go through and adapt to. But humans, we are very adaptable. We're very good at reacting, or at least I hope. I think we're good at reacting to a situation.
I think that's something that was personally tested. as individuals, you realized you as a person, what could you tolerate and what could you not tolerate, and how comfortable were you with the unknown. And a lot of people are not comfortable with the unknown.
No, they are not. I've had a lot of conversations with people about things like, I don't know, well, the hesitancy once the vaccine came out, it's going through too quickly, like they couldn't have tested it through that. But, when you actually look into it, the science, has been around for a long time for mRNA, right?
Correct.
I hope I'm correct. Yeah.
They had been actually using it in cancer treatments previously, so it wasn't like they just created the technology dedicated for the vaccine. They adapted a pre-existing technology to vaccines, and yes, it's the first mRNA vaccine, but at least from the 7 years of data we had beforehand, we knew that there were no harms in at least that 7-year period.
Yeah. And I mean, it was also a massive collaborative effort from people around the world to kind of find an option that worked for this vaccine. We heard a lot of news stories of one that's promising, but it fell out. But then eventually we came apart these several options that worked out and that we're using today. It was,
I don't want to say heartwarming is the right word, but it was very, I was very happy to see the collaboration between countries all across the world.
Yeah. It was a positive moment, and in our current political strife, you could say, with the divisions that have unfortunately created schisms between people, that we still have that potential for collaboration. That maybe things aren't all hopeless, and that maybe we can eventually come back together.
United. Yes.
United. That's the hope, at least. Mm-hmm. So going through this whole system, how were you feeling during the period of time? Because that's something that many people from the public might not think of. What are our healthcare professionals going on? How are they feeling when they get home?
Tired is the main question, or main answer, I should say. I personally was kind of modeling things around what had happened during the last pandemic, which was the Spanish flu, and kind of always had this 2 to 3 year mark in my mind of when things would settle out, and hoping that would be the case this time around. It was kind of difficult in that you not only had to deal with your own inner uncertainties, but then also had to deal with that of your friends and your family, because you were their resource for information as well.
Yeah.
And so it was a trying time.
Of course, it was trying for all of us, and just a thank you from the public for your dedication. There were so many people instrumental getting through this time. Healthcare workers, doctors, our servers, and people working in restaurants, the ones that didn't close down, delivery people. They really helped out get through this, because there's a lot of times where it's oh no, if someone's sick, they physically couldn't get out, and then services delivery services helped them out during that period of time. Mm-hmm. Those people putting themselves at risk. Yeah.
And I don't think the public had ever been as grateful for grocery workers as they were until the pandemic hit.
Mm-hmm. Yeah, you never think of the person packing your groceries. They were going through it. They were working through the whole thing and putting themselves at risk. So wow, they're heroes in my eyes. Mm-hmm. Mm-hmm. So through this whole time, for people who aren't in the healthcare fields or follow scientific inquiry and how the scientific process works, it felt sometimes that the information we're getting from our officials felt conflicting. I guess just from your perspective, how did you feel about the information that you were receiving from our leadership?
I think they did the best they could with the time crunch that they had. Part of the way the scientific process works is that we have time to test out theories and look at the experiences of other people's in different parts of the world. And we didn't get a chance to do that with this because we had to react to the information as we were getting it on a week-by-week basis. So with the resources and the time crunch that we had, I think they did a pretty good job. In hindsight, was there a couple things that should have been done a little bit differently? Yes, but we're always going to have better hindsight than in the moment.
Of course, like hindsight is 50-50 in every situation. So now that we're on the other side, we're in this new normal, and there are still cases, and for people who are immunocompromised, it is still a concern. So it is important to be aware of that. So if someone does ask, hey, please wear a mask around me, like let's be kind of that. But once we've got through this whole thing, what do you think we can learn from this whole experience just kind of moving forward?
Well, I hope that we learn how to be kind to one another, whether you agree with them or not, how to be civil. One of the things I think that the pandemic really showed was that it's a lot harder to stay united than it is to be divided. The simplest thing could even divide friendships, families, right? Mm-hmm. So trying to rebuild that again post-pandemic and not letting it happen again for such small things. Yeah.
Yeah, I think almost everyone has a story of how, there was a division that started. So yeah, just looking ahead, let's work together. Let's bring some positivity into this world.
Mm-hmm. We can achieve much more united than we can divided.
Well, thank you so much for taking this time to chat with us, share your perspective of what it was like as a healthcare worker and professional during the COVID-19 pandemic.
My pleasure. Thank you for having me.
This project is funded by the Government of Canada through Canadian Heritage.